Welcome back to another episode of Paladin Financial Talk. I'm your host, Nikki Foley, and I'm here with Mr. Tony Shore.
Awesome. Well, Nikki, great to be here.
Tony, I feel like we've had some time together recently. It's been good.
Yeah, we have. And we just Paladin had a great event for clients talking about insurance and elder care and other things that my wife and it's really important to us. It was so good. I even took notes.
Oh, Tony,
and I saw some
notes.
I know. I got some great tips. You had a great speaker from Nationwide, I believe, on. Yeah, that was great, and it was a pretty full house there too. So,
well, Tony, you made an impression on the team at Paladin. In fact, you were the topic of our morning meeting today. First of all, somebody said something very nice about you, and they were bragging about you a little bit. And then somebody else chipped in, and they said something nice. And I said something nice about Sarah because I just think she's a rock star.
Yeah.
And then we heard the story about the mushroom water, and from there you came down. So we've just had lots of conversations today.
Oh yeah. The mushroom water story is funny because it was gonna begin and we had to eat our food, so we wanted to get sat down, and I saw one of your staff members, Zach, and I'm like, Zach, he was in line to get drinks, and I go, would you mind getting me something so we can go sit down and eat our food and bring it back to the seminar for me? And he goes, sure. And I go, anything with caffeine. I just need some caffeine, right? Some energy. So he comes with one of the slimline, looks like an energy drink, and I see the word like energy or whatever, or caffeine. I'm like, perfect. And he goes, you sure this will be all right? This is all they had with caffeine. And I'm like, no, that'll be fine. So I start drinking it, and I'm like, oh, it tastes a little weird. And I look, and it says, contains mushrooms. And I'm allergic to mushrooms. In fact, certain mushrooms but only certain mushrooms, right? And there's so many varieties that, But when I was a kid, I ate a pizza with mushrooms on it that I was allergic to, and I puff up, red rash. So I didn't finish the drink. And I think Zach knew that I was allergic to mushrooms and was trying to take me out for some reason.
This morning, his version of the story was, I got up there and they didn't have anything with caffeine except mushroom water. Who drinks mushroom water? But I got one from him anyway. And so we had a pretty good laugh about it, not even knowing that you were allergic to mushrooms.
Yeah, no, he didn't know. And he didn't say, though, when he handed it to me, he kept saying, are you sure it's okay? And I'm like, it's an energy drink, right? And he goes, yeah. But he didn't say it as mushroom. But then I looked, and the label clearly says, contains mushrooms. And I'm like, oh, my goodness.
Well, Tony, I'm proud of us already on the show. We've already talked about pizza, too.
Yeah, I worked to that end. But I think we're burying the lead for today's show, Nikki, which is your outfit.
Oh, okay. Yes. For all of those that are going to tune in on YouTube. Okay. So it is Spirit Week. Last week, we got all the kids back to school.
Yep.
And there's enough parents in our office that we said, let's do a little Spirit Week. Like, let's have some fun. And so beginning of the week was Ellie's birthday. And it was kind of a milestone birthday for her. So we did decades. Yeah. And so we dressed up. I dressed up as my best Cyndi Lauper Madonna combination. And so I had my 80s gear on. Everybody took a little different spin on it. Jeff was LL Cool J, I think. And so, we did it right. I felt like on Monday.
Of course, Jeff was LL Cool J.
Yep. And then we had, 9/11 was this week. And so we did red, white, and blue.
Yeah, that's nice.
And then today is bold. We are going bold. So I am polka dotted today.
That is a bold outfit.
Yep. And we had bold chips that we shared with you. I just had a lot of time for this week. It's been great.
Yeah. I love it when I can hang out with the whole Paladin team. And Monday night was great to see everybody together. You've assembled a great team there.
We have really good
with the exception of Zach, I think it's a great team. I'm teasing.
Zach's not going to live this one down. It's never going to go away.
I'm kidding. So what are we talking about today?
Well, we have been talking about, my favorite topic is mixing all of this health and wealth together.
Healthcare, yeah.
Got it. And so we are really going to, Monday night was kind of an extension of what we've been talking about and kind of a future look at where we're going. And this month, we're going to continue those conversations of funding your future healthcare needs. And so I'm starting this week and going to focus on the Medicare side of things. Matt is going to come in next week and talk about the long-term care planning side of things. And then our final one for the month is going to be with Jay Dacey. He is focused on the reverse mortgage side of things.
Yes.
It's not what he does exclusively, but he is going to share with us some of that product has really come a long way.
Yeah,
and, and it's important to kind of re-educate yourself on that. And he's such a good resource for us. So that's what it's going to look like, again, is funding your future retirement healthcare needs and expenses. And so with that, we'll try to give some basics and make this pretty practical along the way, not diving into too many details. But right now is a really important time on the Medicare side of things. It is open enrollment season coming here in the next month, and that will go, all fall through early December there. And so just throwing a few things in there this week about that as well, and then looking at planning for future needs. So with that in mind, we can dig in if you want.
Yeah. And I look forward to this. And it kind of ties in what your Monday night event, the Paladin event this past Monday was.
Yeah,
right?
Exactly. Let's expand on that just a little bit, Tony, because it is really an extension of what that conversation was. And Jeff last week was with us, and he talked a little bit about the 4 pillars, and all this stuff wraps together. And one of the things, just going back to Monday night, was we host 2 client education events each year. Usually we try to make one of those on a market update, and it's one of our live events. And then this one was on that conversation of aging and what are some of those challenges, and then really tying it back to the financial side of things, which, again, the speaker was Dave Harris of the Nationwide Retirement Institute. And this is what he does all day, every day, is he delivers information like this, relevant information to an aging population. And healthcare is one of those big pieces. And so and much of his message was centered around the experience with his parents. And there's nothing better than hearing somebody else's story and what they have been through. And you can't help but just can't wait to hear what the next piece is and what that experience looked like. And he had, I think, a very common, some of probably the most common things that we hear when it comes to the health of what happens to people as they age. Mother with dementia and Alzheimer's, and the stages that go along with that and how long that lasts for some families. And then he had a parent who fell. And then once somebody falls, so often other things start to come from there. And that was his story. He's an only child, so he was front and center and really the primary person that was navigating this. He'd been in the industry forever, but like many parents, they still view you as a child.
Oh, yeah.
The parents didn't allow him in until much later, and as some of these things started happening. And so really the message I took away and what I, really resonated with me is, one, your world can change overnight and very quickly. And so what can we do to be prepared today so that you can avoid some of those pieces and last minute decisions and on the fly things, and maybe go at it in a more organized way is what we're hoping for along the way, and financially be very organized for it as well.
Yeah, I mean, you need to have a plan and work with professionals who can help you. And I know this is something you help your clients with. It was great to hear from Dave. Of course, I related to so much of what he said because I'm an only child trying to do the same with my parents who have Lewy body's dementia to go along with Parkinson's. So it was amazing how much his own story paralleled mine.
I thought about you a few times.
And I bet you did. Yeah, because what I've been dealing with. And so that was so helpful, Nikki. And I want to encourage our listeners and viewers out there, if they hear about a Paladin event, if you're a client and you hear about a Paladin client event, or you're a listener and you hear about an event that's open for listeners from Paladin, take advantage of it because they are very educational. And I know along with some of them are reports that you'll run at no charge for people so they can see where they're at.
Yeah, exactly. That was one of the things that we offered at the end of the evening. And, one of the things that we didn't stand up and do is talk about specific solutions for people in the audience or even products that might solve some of these problems. Just, kind of highlighted a couple of things, but everybody's story is a little bit different. And so at the end of the evening, we did offer to do a personalized estimate of retirement healthcare costs, and really nationwide, using all of their tools and resources are the ones that will do that. But it's essentially just a bunch of information gathering specific to you, and think about how long it would be to gather what the estimates would be for healthcare facilities. I mean, it's not hard, but you gather that plus your Medicare costs, plus your medical estimations. There's a lot that could go into that. And so why not let somebody else do that on your behalf, put a pretty report together, And then if that's something that our clients are facing or our listeners are facing, we can go through that report and say, how much are we prepared for? Where do we need to spend our time and our attention? And hopefully that helps along the way. Just give them a snapshot of what could come.
Oh, super, super helpful. I mean, you want to be prepared. And like you say, that looks different for everybody, right?
Exactly. And so while you do want to be able to stand up there and go through maybe some more detail, being very respectful of everybody looks a little bit different. And so wanting to make sure that those conversations take place individually and we can really dive in. And this report helps kind of foreshadow what and set the what it could be for healthcare cost in the future.
Sure.
So I don't know. I think as part of retirement, people understand that they have health insurance, but I think there's a lot that they maybe overlook along the way. And I don't know, Tony, if you feel like this applies in your situation or if you guys were really organized, but I do think that there's some misconceptions about what people think they're going to have to pay, about what the government should be paying, what they're actually going to pay. And that's probably one of the things I hear a lot when people come in for Medicare. They're somewhat surprised about how much healthcare, how much isn't paid for by Medicare.
Yeah, Medicare doesn't cover everything. And a lot of people, I used to think, and a lot of people I know think that when they turn 65, that Medicare will kick in and it will cover their health care. And it does not. There are still expenses out of pocket, and there are still premiums, deductibles, copays with traditional Medicare, and then things it doesn't cover. That's what surprised me. And if you have, a lot of people out there have a lack of planning. And, Sarah and I were in that boat before we started working with you guys and looking into this. And the lack of planning is really going to hurt you down the road, because you do need a plan in place for healthcare costs. I mean, what are the figures are like $200,000 to $300,000 out of pocket. The average couple who lives past 65 will end up spending in retirement.
And I honestly believe that's probably an underestimation of what it could cost. I think the most recent figure that I saw and that I have in one of my educational events is $300,000. I really do believe that for some people, it's again, that's working in averages, but for some people, it certainly can be more than that. And I think just communication among family members. I was wrapped up the evening and talking with clients, and I love to hear everybody's stories, but some of them aren't always positive, and you have to figure out how to navigate that. And one of the things that Dave, the speaker on Monday, was talking about was taking keys away from a parent. And that's not an easy thing to do. And I know that I haven't been in that position yet, but many have.
I have.
You have.
I am currently going through it yet with my dad.
Yeah.
So,
and one of our clients shared how they also had to go through that experience, and their parents haven't quite recovered from that, and they still have feelings and emotions that go along with it too.
That's where my dad's at.
Yeah. And so I think as proactive as we can get and as much planning as we can get is really critical along the way. And so from a financial aspect, I think that's where we want our attention to go. And back to where Jeff Foley was at last week on the show, he was talking about our 4 pillars. And we've always done a lot of conversation clearly on the financial side of things and Social Security and planning from that perspective.
Sure.
But in the last few years, we have done a much better job of incorporating taxes and estate planning. And this year, our focus has turned so heavily to the health side of things as well, because I think that a lot of people aren't talking about it and aren't truly reflecting what the expenses could be in retirement. So you simply can't leave it out of your plan. It's kind of the big picture.
Right. And there's a lot to it. I mean, there's lack of communication. We talked about lack of planning. And amongst family members, I saw that you don't want to create family disharmony. You want to communicate before you get to these points, but that's easier said than done for some people and some families, right?
And you think about, this is something I was also talking about with one of our clients. You are you're an only child. I grew up in a family of 4, and how different people brothers and sisters come out of the same household with completely different perspectives on life. And oftentimes a parent has to be still in the middle of things as we all age. And once they are gone, if you can get things figured out before you pass and you leave it to the siblings to figure out, there's certainly some breakdown, and families have fallen apart because of that. So plan now is my point in all of this, and get as much done as possible.
Plan now, plan often.
Yeah,
It is what I like to say. Yeah.
Absolutely. And one of the things that the presentation as we moved through it, it was a lot about the cognitive as well as the physical things that happen as you age. And I think it's important to think about so many people come in as they're signing up for Medicare at age 65 and they're in great shape and they don't need a lot of prescriptions. But as you're making your Medicare decisions, I think it's really important that you are starting to look at what's present today, but what does my future look like as well, and making sure that, that's a key piece along the way. Have you, before I really dive into the Medicare side of things here, Tony, have you heard the story? And I'm sure you have, but it's about, filling the jar with rocks, pebbles, and sand, in which order you should go in?
Yes.
Okay. So I actually was listening to a podcast this morning, and that was one of the stories. And I thought, oh my gosh, it kind of applies back to what we're talking about. So if you start with like the sand and then you put the pebbles, there's no room left for the rocks and the boulders along the way.
Right.
But if you do it the opposite way, you start with your bigs. So put the rocks or the boulders in, and then you fill with the pebbles and the sand. It all magically fits inside the jar, right?
Right.
Okay. Well, I think that same concept applies back to your finances. Clearly, healthcare is one of your rocks, one of your big ones, and you have to prepare for that. But as you get into the scope of healthcare, there really are some major categories for consideration. And so Medicare is going to be one of those resources that are available. And knowing really clearly what it's going to pay for and what it's not going to pay for is one of the things I think it's important to settle for. Some people, and this is very common, and maybe not initially out of the gates, but what role is Medicaid potentially going to play in your health plan along the way? And so often people have the belief that they want to pay for it, and that's, they're planning to pay for it, but they may get into a situation where they are living longer and this is not going to last. And so being aware of how Medicaid works or how it doesn't work, I think is just some simple information gathering is a good thing to know.
Yeah, we did not. And then my mom and dad got themselves into a situation because my mom needed long-term care. And I think the reason people now, more and more people are needing Medicaid, and the reason is because of the cost of long-term care and how many people are needing it. There's so many more people are going into long-term care. Those numbers are skyrocketing because, and Dave even said it on Monday night during the presentation, about 11,000, a little over 11,000 people a day turn 65 right now. In the United States. 11,000 people per day in the U.S. are turning 65 and will for a number of years. That'll continue. So that puts a lot of burden on our system. Plus, we're living longer. That's the good news, is we're living longer. The bad news is, Nikki, we're living longer.
Exactly.
Yeah.
And
I always say that, but
there
it's
was
true.
Also a statistic about how Alzheimer's is supposed to double in the next 25 years. And so again, back to that is when people really have to start having care, is when the cognitive side of things,
Right.
is slipping. I can't even remember where I was on with the rocks and the pebbles and all of that, but Medicare being a key piece, Medicaid being a piece of it. The other, some people plan for Medicaid to be their answer. And I think if that is a plan that you have, really knowing how that's going to work is important. And so there are, kind of two components of that. One, what is your income? But when you pass 65, it also becomes about what are your assets. And that is where people, just knowing how that works. And there are elder care attorneys out there that can support on that. But if that is a component that you think is going to impact you or a parent or a loved one, somebody should be involved with the education. And it feels like it's quite complicated if you try to just go out there and research something.
It is very complicated because that's exactly what I did initially. And it's tough.
Yeah. So knowing the role of Medicare, the role of Medicaid, and then long-term care insurance, as we talked about, what role is long-term care insurance? And it's not necessarily that traditional long-term care insurance that we've always thought about. There's so many things that have evolved in our industry that it is now things known as hybrid. And that's really tied more on a life insurance chassis. There's riders that go along with life insurance policies and annuity policies. There's just a lot of different ways that you can make this work. And while I said at the beginning, we didn't spend time talking about solutions and products, that's something we can dig in on an individual basis and figure out, would that be applicable? Or is it just self-funding it all the way through?
Sure.
What does that look like as well?
Yeah.
And then finally, as I mentioned, we'll have our guest Jay Dacey on the reverse mortgage side of things, because that's also an answer as people, age and one partner has gone into a facility, but the other, the other spouse is still at home. You are maintaining basically two separate lives and paying for that. And how are you going to do that? And if you do have a home and it's fully paid for and you have a lot of cash in that, it might be an option that is worth considering.
Yeah. And again, that's based on, everybody's situation is different. For some people, reverse mortgages aren't a good idea. There are cons. For some people, it's going to be the perfect or only solution.
Yeah, exactly. Absolutely. And I think it's fair to say, we know that there has been negativity around long-term care insurance policies. It has to do with nobody wants to pay into something and never use it.
Super expensive premiums and use it or lose it. People do not like that.
Yeah. And so we are well aware of it. So as we talk about things, that does not mean just because we're talking about long-term care planning that we are talking about insurance. And the same thing goes for reverse mortgages. A lot of people have heard negative things. Well, let's, take time to educate yourself is all I think the message from Dave was, and the message.
Things have changed greatly, and everybody's situation is different, but there are strategies you can use. It's not, in fact, I think very few people are just using straight long-term care insurance like it used to be, because very few people are offering it even anymore because it just doesn't work.
Yeah, exactly. You said something there that things have changed, and you have to recognize and kind of step back and look at what is happening. Our population is aging. You talked about how many people are turning 65. This industry can't sit on the side and let the products just be. There's so much evolving right now, and so many things that they're working really hard to make sure that these are good products for our population. And so being open-minded and educating yourself is really the spirit of all of this.
Yeah, I think it's important to educate yourself. And in that same vein, don't try to go it alone, though. I don't think you're just going to Google or YouTube the answer. As great as these shows you do each week are, they're to try to motivate people to show you what is important and what could be costly mistakes. And then work in person with a financial professional to get the personalized reports run on, what your healthcare costs might look like, what strategy might work for you.
Yeah, you have said that, Tony, so well. These shows are designed to pique your interest. And then if this applies to you, call us at the office and make sure that we can get into the personalized side of things.
Sure.
And really look at the whole picture. As it relates to Medicare, though, I think because we're talking about, the long-term care side of things as well, it's important to say it now that Medicare does not pay for custodial care. And that's kind of industry lingo when I say custodial care, but that is going to be your non-skilled personal care that happens to people that they need somebody to help them take medication. They need somebody to help them with their daily activities. It's all the things like bathing and dressing and eating, and it's one of the first things that people need along the way. They don't necessarily need all of that medical care. They need somebody just to assist them. And so.
But Medicare doesn't cover long-term care. I mean, and it's only in that instance where they have to, if they've had a 3 or more day hospital stay and there's a rehabilitation period that the doctors say they need from a long-term care facility, then they'll pay for up to 90 days, possibly. It depends on what the doctor says. But that's not really long-term care. I mean, my mom has been in long-term care 3 years. So, and she didn't go directly from a hospital. She went in because she fell, but then she went back home and tried to do it at home, but just couldn't. My dad couldn't handle it, so she had to go into long-term care. So Medicare covered none of it for her.
Dave told the story the other night how his mom was in rehab, getting assistance, getting back on her feet. And then, there's a duration on that, what that looks like. And basically she got to that and she walked across the hall to a different room, and all of a sudden it was on them to start paying for thing. And that would that
when they say she's not going to get any better, when the doctor determines she's as good as she's ever going to get, but she still needs long-term care, that's, even if it was only 18 days, not the full 90, that's when Medicare stops paying for it.
Yeah.
Maybe it was 10 days.
And I think what you said there, Tony, is such a trigger for me, that you want to be in control, and the way that you are in, like the doctor's decision there, even though it wasn't the 90 days, as you said, the doctor made that decision, and therefore you are no longer in control of your future and what's going to happen, the dollars that are going to come out of your pocket. And that's why it's so important to do everything you can to control your situation and get your finances in order related to this. And so limited duration, what the doctor says, co-pays, all those things are important to plan for. I think as it relates to right now with the Medicare side of things, this is a really important time in the year for many people. So it's known as annual enrollments, or AEP, and it is that key time of year when people can make some decisions related to plan changes. And so specifically, you can switch from original Medicare to a Medicare Advantage plan or vice versa. You can move from one Medicare Advantage plan to another Medicare Advantage plan.
Yeah.
You can shift from one Medicare Part D prescription drug plan to another one.
And that's huge.
Right now, it's really huge. We're going to talk about that one in just a second. And then maybe it was in a situation where you didn't previously enroll in a drug plan, and now is your time, your window to do that. And so there's some very specific things that can happen right now, and it's really critical that you do that. And this runs from October 15th through December 7th. And so that's your time frame. And then decisions that you make go into effect on January 1 of 25. And so I think it's important to recognize that that's coming. And one of the pieces that's really big this year has to do with the prescription side of things. And so almost everybody who is in a plan of some sort really should take a moment to look at their plan and look at the communication that is coming from their carrier and make sure they understand it and make sure the impact of what's going on. So at a very high level, the prescription drug coverage is changing. And the goal of all of this was to make sure there were less expenses for the end consumer, the user of the plan. However, when you take expenses away, somebody still has to pay for things. And so it's being reallocated. But in a very high level, your out-of-pocket expenses are going to cap closer to $2,000 versus $8,000.
Wow.
So what a win. But just understanding that is going to be the key piece of that and how that might impact you. And so that's why, again, you say this many times on our show, is you want to meet with your professional, your expert that's working with you on Medicare.
And you're the Medicare specialist at Paladin. You talk to people about Medicare and what their options are.
Got it.
And help them review it each year if they need that help.
Exactly.
And that's something you offer your clients at Paladin.
Exactly. So we started that this year. So we have been doing this throughout 24. And if we haven't had an opportunity to meet with our clients or anybody, we're very open to making sure that we are having this conversation on the Medicare side of things and making sure we understand how it fits into the bigger picture overall.
Yeah.
And so again, back to the prescription side of things. So the good news is it should reduce costs for those who are really on prescriptions and are actively using that piece of their plan. However, it's important to know that if this thing over here changes, is it going to impact anything else in your plan? Are other things changing to help recoup some of those costs that may have shifted because of that coverage? And so, again, really important to look at the communication that's coming from the carriers right now, and then take time and meet with somebody, whether you have an existing Medicare person or you want to meet with our team. Like, come in and let's make sure we review this and know the true impact it's having on people.
That's good to know. I'll have to look at what my parents, I know they have an Advantage plan of what that situation's going to be. Because during open enrollment or the annual enrollment period or annual, what is it, AEP?
Yes, exactly.
Yeah.
Enrollment period.
Yeah. So they can actually figure out what they need to do. Sometimes people need to switch, but I think it's smart for people to review their Medicare plan and strategy once a year anyway during this time.
Absolutely. And it should be a situation where your Medicare professional is proactively calling you and contacting you and being your advocate and telling you what is changing along the way. And then you guys make decisions together. And so that's what you want.
Sure.
And the role that you want from your specialist.
Yeah. Well, Nikki, I think this has been a great show. I think, though, as important as this topic is, that we kind of buried the lead, and I wanted to wait toward the end of the show, but what our viewers out there are going to want to know is, are those earrings of yours, are they homemade, or where did you get those crazy earrings?
I did not make them. I wish I had that talent and I wish I had that time, but they are handmade.
Yes.
And so, yes, and they match my red shoes to go with my yellow as blue polka dotted outfit that I have on today. So if they say go bold, no problem. I'm bold today.
Yep. Well, we have to wrap up the show.
Let's.
You covered a lot today, Nikki. This is so important. But I bet our listeners, we've probably raised more questions. And what can they do? They can set up a consultation with you in your office there and the Paladin team?
Yeah, let me go through a couple things.
Okay.
We talked about at the very beginning that report. If that is a report, it's the personalized expenses that they would estimate for you for your health care. We can do that. So if you are interested in that, email us at info@paladinfinancial.com or just call us at the office at 651-842-8406. So we'd love to offer that complimentary for anybody who wants that information. Yes, we probably raised a number of topics. So whether it is Medicare, whether it's the long-term care planning side of things, we would also love to meet with you on that and just go through what is your situation and is there anything that is keeping you up at night and gaps in what your plan might be today. So again, same information, email us or call us at the office at 651-842-8406. And we will be covering more of this over the next 2 weeks with Matt Bryant from our team, as well as our guest, Jay Dacey.
Oh, yeah, Matt Bryant and Jay Dacey. That'll be a good episode. I'm looking forward to those. Nikki, thank you for a great show. Listeners and viewers, thanks for tuning in. That does it for today's episode of Paladin Financial Talk with our host today, Nikki Foley.